This is an introduction to EMD through viewing and navigation. Once you launch the icon on your computer, you'll be prompted to log in. Your login screen will look like this, and you will put your personal username and password. Once you log into EMD, you'll be taken to your EMD homepage. Here you will see that you have chart tabs that include patient information and various ways to document. You have icons with their own functionality, toolbars, and other applications within your EMD homepage. We will explore each of these through the rest of this video. When you first log into EMD, your default tab is your patient list tab. This is going to display your patient list or your unit census. In order to make your chart active, you'll need to physically click on a patient, and you'll see that your icons become available to you. In this tab, you will create patient lists and columns for individual preference. We'll now go over your gateway toolbar. This is located in the top right-hand corner of your EMD screen. The first icon is your help icon. Once you launch this, you'll be able to search for any help topics available to you. Your next button is your shutdown. When you're completely finished with your application with EMD, you'll use this. Your half moon is your suspend. It will suspend your session and allowing you to document at a later time. User preferences and recently viewed patients. Recently viewed patients will hold the last 5 patients you viewed or documented on in 48 hours. You can then access their chart by highlighting the patient, choosing the application in which you opened their chart with, and selecting them. We will now navigate through the main toolbar. Your main toolbar is located at the top of your EMD screen and contains a series of icons with their own functionality. You can customize this based on your preferences. The first 2 icons are previous and next, which will move forward or backwards within patient lists, orders, results, and so forth. The next icon over is your refresh screen. We have a Find Patient icon that allows you to look up a patient through their birth date, their last name, or their MR number. It defaults to the MR number, which is the easiest way to find a patient. Once you enter that number, you will click on Search, locate the patient, verify that it's the correct patient, and say OK, and they'll be added to a temporary list. The next icon over is a Find Visit icon. This also allows you to look for a patient using their visit number. We then have our allergy summary, which is also referred to as an itchy man. We have an Enter Document icon, which allows you to enter structured notes. Worklist Manager is our EMR, or medication documentation. More header info will allow you to look up more patient information. Change location, we can transfer patients to different beds. LexiComp is your online drug guide. Print Report icon is going to allow you to print whatever reports or documentation you may need from EMD. Health Manager is for vaccines or immunization tracking. Your Outpatient Medication Review, or OMR, is your home medication list. Signature Manager is how you're going to document or sign off on tasks assigned to you. Your Document Scanning is for advanced directives or other scanned documents. CRAMES is your online education, and Optio will allow you to get to our paper documentation. Customizing your main toolbar is through the preferences at the top of your screen, utilizing the toolbar, choosing the appropriate icon on the left-hand side under available buttons, using the addition sign, we'll add the icon to the right-hand side. To take away any of the icons that are currently in your toolbar, you can locate that icon on the right-hand side, highlight it, use the minus sign, and it will take that icon off of your main toolbar. To name your icons, you can then use these drop-down menus for preferences, and you'll want them to say Show Text Labels. This will name both the main toolbar and tab toolbar icons. Then you'll say OK, and you will see that the changes are reflected. We will now talk about your patient header. The patient header runs across many screens in EMD and contains useful information. You will have one icon in the patient header, which is your Enter Order icon. Your first and last name of your patient, their current location, their code status, allergies and intolerances will populate. And if you notice, as you hover over these areas, different conversation boxes populate with additional information. Your patient's physician, their MR number and visit number. Other information you may see in your patient header is isolation status and also codes for social work. Your patient's age, birth date, and sex also populate. We will now navigate through the Chart tabs and Patient List tab within EMD. EMD contains a series of chart tabs that mimic a paper chart so that you can navigate through your patient's information. In order to get to that patient's information, you need to first select them from your patient list. You'll see that the patient is highlighted in blue in the list below. The Patient List tab is your default tab. It contains a list of patients for your unit. You can create lists based on location, based on specialty. You can create personal lists. These will populate in the Current List drop-down menu. And you can create as many lists as you need to. You can also customize your screen based on these columns that you will see here. These columns contain useful information such as check orders, new results, your patient's name, their location, provider, visit status. You can customize these by using the Select List column icon and save personal lists by using this icon here. Customizing your columns by clicking on the Select List Visit column icon in your tab toolbar works the same like your main toolbar icons. You can choose from the left-hand side, which is your available columns, and add them to the right by using the Add button. You can also take away columns that you currently have by highlighting them from the right and choosing Remove. You may move these columns order by using the Move Up or Move Down icons on the right-hand side of your screen. Once you've made all the necessary changes, you will then press OK. Your new column selection will reflect on your Patient List tab. However, if you wanted to change the location after you already hit OK, you can simply drag and drop your columns to new locations. This may be an easier way for you to manage your columns. There are two buttons for Flag On and Flag Off, and you will see that you have a column that says Flag New. You need to turn these on every day that you work in order to be flagged for new results, new orders, new documents, and so forth. You'll see the flags that populate. We will now navigate through your Orders tab. Your Orders tab is not for order entry, but more order review and management. On the left-hand side, you would have an options panel that allows you to filter and choose different options for viewing your orders. You can view just this chart, all available charts. You can change the date. By choosing the arrow option, you will be prompted to a quick pick menu that allows you to further customize your view. You will need to use the red X to get out of any quick pick menu. Under the display format, you can choose how you'd like to display your orders. This menu also matches the green square icon in the tab toolbar. Order entry session is an option that will allow you to see who put the order in. And this icon does the same. Moving down to the filters in the options panel allows you to change the status or priority of how you view your orders. Active orders is an option. This will filter out all completed or discharged orders. We will now go ahead and navigate through your Results tab. Your Results tab also has an options panel that allows you to filter out how you want to view your results. There are 4 ways to view your results, and they are all user preference. This is your Report by Order view. The most recent lab or procedure will populate to the top. If there are any reports, such as a chest x-ray, a ultrasound, or whatnot, you will have an icon with a black addition sign that will allow you to view the report, but not the image. You can also print this report. This option of viewing will need you to scroll through your labs. The only image that we do scan into our results tab is our EKGs. You will locate your EKG and you'll notice you'll have two icons. You'll have the square icon with the black addition sign, which will allow you to view your results. The report can be printed. Locating the icon next to it takes a few seconds to load, but we'll bring up the EKG. So you can then view the actual EKG of the patient. And again, this is the only image we scan into EMD. You can use the icon in your tab toolbar for display view. Again, we were looking at the report by order. You have a summary view. This gives you a bigger snapshot of time. Your labs will display in the designated boxes. Once you double click on the flag, it will allow you to see your result in a report by order view. You can change the display view to another view. You have a trending view. I'm going to use the reset button so that I can default back to my beginning of the chart. This will show me again a greater time frame of results. I also have another option called a trend and graph. This portion of viewing results will allow me to see the trend at the top of the screen, and then in order to graph it, I just need to tell it what result I want to see. So in this case, my WBCs will be graphed at the bottom of my screen. We will now navigate through the Patient Info tab. The Patient Info tab is separated into a summary view and data entry views. In the summary views, you can take a look at allergies, intolerances, care providers for this patient, their problem list or diagnoses, and any significant events such as falls, hypoglycemic event, or any codes. You can also look at the patient's demographics, address, and visit history. Data entry will allow you to also enter allergies and intolerances here, discharge a patient, enter admission height and weight, and significant events. You can also view advanced directives through this area. Once you click on the contacts and directives, at the top of the screen, you'll have an option for scanned images. Once you click on that, it will prompt you to another screen where you then can locate the advanced directive. They are scanned in page by page and will be listed that way. You can click on the necessary page, print from here, or review. However, you also have an icon that we went over to prior, which was called your document scanning, which is a straight shot to the screen we just saw. Your Documents tab is going to hold most of your structured notes and any nursing documentation once saved. Different types of documentation you will see are HMPs, physician progress notes, your admission paperwork, discharge instructions, and so forth. You can change the display by document name, document status report, whatever your preference is in viewing your documents. You also have an options panel to narrow your search. It's important to know that you have a previous and next arrow on the far right-hand side of your tab toolbar. So if you're not finding the document that you're looking for, be sure to see if those are highlighted. To view a document, you will simply find the one that you are looking for, make sure it's the correct date and time, and you can double-click on it. The document will populate in its own window in this nice view version. It will show you that it was completed by and the time with your patient's information at the top. You can use the red X to get out of this screen. Viewing multiple documents can be done by clicking on one document and dragging your cursor, using the View icon. Once this menu opens, you're going to use the Document Details option. And your documents will be all combined into one so that you can scroll through them for easier reading. You can also use the document selection on the left-hand side to click through each document as necessary. The Flowsheets tab is mainly for nursing documentation. However, CNAs document here, respiratory, and most clinicians. You can change the date for easier viewing, and in the middle of the options panel, as you see here, there's a flowsheet selection. It defaults to the patient's current location, and all flowsheets that will be needed for the patient will be added. You can add others, such as restraints, conscious sedation, and so forth, to customize your patient's documentation. You will also see if they come from another area that it will be separated out and those flow sheets will be underneath them. You can use the Expand Collapse Rows icon to see the documentation criteria easier. We will now look at the Clinical Summary tab. The Clinical Summary tab is a nice snapshot of your patient's care. You can change the time frames. This is best used at bedside shift report. First thing that you want to do is change the view so that it reflects your profession. We have nursing, there's CNA, there's a professional exchange, there's also physician views, and so forth. Make sure you find the one that is appropriate for you. Once you choose that, you can change your default setting by using the icon that says Save Display Format and Save as Default View. That way, every time you log in, it will be saved for you. You can also use the Expand Collapse Rows icon in this tab as well. For some of the views, the clinical summary is quite lengthy, so this is an easier way to navigate through instead of scrolling. And basically what it does is it collapses all the tiles, and you can use a double arrow to the left to open and close each tile. Here I am looking at the plan of care. I can view the plan of care that the patient is currently following, and I can also see how it's been individualized by other disciplines. I can take a look at the Documents tab and view documents, such as H&P, admission paperwork, and so forth. There is active medications, there's IVs, there's skin assessments, significant events, procedures, vital signs, height and weight. There's quite a bit of information that pulls in. And you'll see if I'm viewing a document, I can just view it from here. I can't chart to it, but I can definitely read it. You can modify the time frame in which you want to view information. Otherwise, on the default setting, it pulls from the last 24 hours. And remember that the information must be documented in order for it to pull in. You can also see a list of care providers. You can also see a list of home medications that the patient was on. This is a very useful tool once you get the hang of it. The last tab we will talk about is the Data Viewer tab. This is in addition to the clinical summary, which is a great useful tool of information for your patient. The Data Viewer allows you to specialize the information that you want to view in a bigger time period. You'll again want to change your profile. This one says Nursing General. Once you change it, it will stay the same every time you log in. You can change your time frame, your dates, and up to a 2-week period. On the bottom left-hand side is what you can specialize in seeing. Anytime you make a change, you're going to choose the Apply Changes. And again, this is going to give you a bigger snapshot of time and allow you to see all the information in one area. On the far right-hand side, you have tabs that pull out. The first one is an Active Meds tab. It's going to show you all of the active meds that your patient is on the last time they were given. The next tab is All Medications, so even those that are discontinued the last time they were given. You have labs that are pending or have been processed. You will see results here. And then More Info actually has 3 tabs that are populating in here. You have their problem list, so their diagnoses. You also have the availability to see their allergies and intolerances and any significant events.